Hello, everyone, and welcome to today's Lunch with Mia event, which you need to know before picking a health plan. My name is Kiana Walton, and I will be the moderator for today's event. This event includes the option for closed captioning. In the meeting controls, you should see a button for closed captioning or CC. If you click on the closed captioning or CC icon, the option will appear for live transcript. This option will show live dialogue on the screen. This presentation will also be repeated on Monday, November 14th at 12 p.m. in Spanish. I will be putting my coworker, Guadalupe Gomez, in the chat box, her email address if you have any questions. Open enrollment season has begun, and many people may find it difficult shopping for health insurance to fit their needs and the needs of their family. To help consumers, the Maryland Insurance Administration has partnered with the Maryland Health Connection to give some helpful shopping tips, as well as to help Marylanders learn more about the Health Connection and picking a plan through their exchange. Just a few housekeeping rules. This event is being recorded. Please leave phones and computers on mute for this event. If you are not presenting, please keep your camera off. If you have questions for today's speakers, please use the chat box and make sure your questions are sent to everyone and not the speaker or host. And we will save the questions towards the end. First, we will watch 2 short videos from the Maryland Health Connection before we get started with today's speakers.
Hi, and how are you this morning? Honey, can you call the pediatrician? Oh.
Get protected from the unexpected. Find a health plan today.
Yes, he's rounding off defender.
I'm okay.
Get protected from the unexpected. Find a health plan today.
I'm not okay.
And now we will have our first presenter, Patricia Dorn with the Maryland Insurance Administration. Welcome, Patty.
Thanks, Kiana. Cute videos. My name is Patty Dorn, and I'm going to be talking to you about health insurance and shopping for a plan during Maryland Health Connection open enrollment. Next slide, please. So what is the Maryland Insurance Administration? So who are we and what do we do? The Maryland Insurance Administration is the Maryland state agency that regulates the business of insurance in Maryland. And that means that we're the entity that licenses the insurers, and we license the insurance producers, so the agents and the brokers, to do business in Maryland. We're the entity that examines their business practices to ensure compliance. That means that we make sure that they follow the laws. We monitor the solvency of insurers. So we're making sure that those insurance companies that are offering you insurance products in Maryland are going to have the money to pay your claims in the future. We review their policy forms in our office, and we review insurance rates to ensure that the rates are not inadequate, because those companies need to be collecting enough money to pay your claims in the future, but that they're also not excessive or unfairly discriminatory. And we investigate consumer and provider complaints. So complaints that you have against an insurance company or an insurance agent or a broker, as well as allegations of insurance fraud. Next slide, please. So let's get started talking about health insurance. I'm going to define health insurance. And we're going to talk about the different ways that Marylanders can get health insurance. And then we're going to talk about some terms and some things that you need to think about going into this open enrollment season. So what is health insurance? Well, health insurance It's a contract between an individual or a group of individuals and a health insurer. It's a contract. Next slide, please. That's going to include insurance companies. It's going to include health maintenance organizations, which are known as HMOs, as well as nonprofit health service plans. So these insurers, they agree to pay part or all of healthcare expenses for that individual when healthcare has been provided and is covered under the contract. This is also known as a benefit plan. Next slide. So health insurance is based on something called the law of large numbers. It means that health insurers collect monthly premiums from many policyholders. So they collect the premiums and then they pool that money to pay for the health care of the policyholders. Next slide. So some policyholders will use very few healthcare services in a year or in the year-long period of their health insurance plan, and some will require expensive or extensive care. So, sometimes we have a year where maybe we only saw the doctor twice. Maybe we only cost our insurer $200, but maybe we have a year where we have a procedure, et cetera, and then we cost the insurance company more than we paid in premiums. All right, so what are the ways to obtain health insurance in Maryland? A lot of people get health insurance through employment. If you don't already know about this, you ask your employer about the health insurance benefits if they're available and whether you yourself are eligible. Some employers offer this benefit to full-time employees only. Some offer it to part-time employees. Some employees, many employers, they pay a portion of the health insurance premiums, and then maybe the employee just pays a little bit of it. And sometimes the employee is responsible for paying the entirety. But if you don't know, definitely check with your employer about health insurance through your employment. Next slide. You can also get health insurance through a family member's policy in many cases. If you're married and your spouse has health insurance, you could be eligible under their policy. And if you're under the age of 26, you may be eligible for coverage under a parent's policy. So if your family member's health insurance is through an employer or another entity, you can check and determine if it can cover spouses or children. Next slide. All right, so our focus today, individual health insurance. Individual health insurance is health insurance that you can purchase for yourself or your family during annual open enrollment period, November 1st to December 15th. And you can do this by contacting the health insurer directly, contacting a licensed insurance producer. So remember, your insurance producer, those are your agents or your brokers that sell insurance. Or contact the Maryland Health Connection during the annual open enrollment period, which they're going to be on in a few minutes to talk to us about that. Next slide. So for the most part, most people sign up during that open enrollment period. But if you have a change in your income or your life circumstances during the year outside of that period, oftentimes you can be eligible for a special enrollment period. That's 60 days after the qualifying life event that you have to enroll in a plan. Next slide. Some examples of these qualifying life events. So if you lose or one of your dependent loses health insurance that meets certain requirements, you get married or divorced, you have a child by birth or by adoption, you become a US citizen or gain lawful status in the US, you move to Maryland from another state, and now you have access to new health plans, you have a change in income or household status that affects your eligibility for financial assistance. This is a list of some of the qualifying life events where you can get that additional enrollment period during the year outside of open enrollment within the connection. Next slide, please. All right, here's another way to obtain health insurance in Maryland. Short-term medical plans. It's an important term to know. If you need coverage for a short period of time, say 3 months or less, you may be eligible to purchase one of these policies. Okay, so there's many reasons where you may have sort of a gap. You're looking to fill a short period of time. These short-term medical plans are an option. The health insurer may require you to provide information about your health history and may deny issuing you a policy or deny paying claims for pre-existing conditions. So what this says is that for these plans, unlike the plans that are available on the Connection, you can be medically underwritten, all right? So they ask you questions about your health history. You need to answer those questions, and the coverage that they offer you and the premium that you pay might be connected to those questions that you answered about your health history. And that's important to know. So what's offered to you might not be as much as the coverage that you would get under a plan that you would purchase from the Health Connection. Make sure that this type of policy meets your needs before you purchase, okay? Maybe it's the perfect kind of policy to fill that gap for you, but you really need to understand what you're purchasing if you are interested in one of these short-term medical plans. Just make sure that you understand, and if you don't, talk to somebody who can help you understand. The enrollment is permitted year-round for these type of plans. There's no open enrollment period. And we have a link at the bottom here. We have information about these short-term medical plans on our website that I do recommend reading before you purchase one. Next slide. Some people in Maryland get their insurance through Medicare. That's a federal health insurance program for people that are 65 or older, under 65 with certain disabilities, and people of any age who have end-stage renal disease. There's some links here, additional information. Those of you who have Medicare, you probably get that Medicare and You booklet in the mail every year, and the contact information is below. Next slide. All right, Medicaid. In Maryland, we call the Medicaid program Maryland Medical Assistance, and some people just say medical assistance for short. So remember, in Maryland Medical Assistance, Medicaid, it's the same thing. Depending on your household income, you may be eligible to receive Maryland Medical Assistance benefits. If you qualify, you can enroll at any time. Medicaid, no open enrollment period. You can contact your local Department of Social Services. They can help you. Your local health department can help you. In general, hospital's social work department can help you, or you can enroll through the Maryland Health Connection. All different options to make it as easy as possible if you qualify for Medicaid to be able to sign up to receive those services through Medicaid. Next slide. CHIP, the Maryland's Children's Health Program. If you are pregnant, have a newborn, or you have a child up to age 19, you may be able to obtain health coverage through MCHIP. You can contact your local Department of Social Services again. You can contact your local health department or the Maryland Health Connection. These entities try to make it as easy as possible for you to be able to enroll in this coverage if you qualify for it. There's COBRA. If you're enrolled in a group health plan and you lose your employment, you might be eligible to continue your existing health insurance coverage under COBRA. And that gives employees the ability to continue that health insurance coverage. That is also an option. Next slide. This shows some additional information where you can get more information about COBRA. I do recommend, if and when you are offered COBRA, that you understand what you're purchasing, and also that you understand what your other options might be. Explore the options through the Maryland Health Connection, et cetera. But just make sure that when you make a decision that you've done your research and that you understand the decision that you're making. We have a lot more information about COBRA on our website as well at insurance.maryland.gov. Next slide. Okay, so just like it's important to know what is health insurance, and those are sort of the basic 8 ways that Marylanders get health insurance. it's also important to know what is not health insurance. So healthcare sharing ministries, that is not a health insurance policy. Healthcare sharing ministries, they are not required to offer essential health benefits that are offered by the traditional health plans. It's not to say they're not required. So you have to be careful. The healthcare sharing ministries, they're also called religious publication arrangements. Okay, so 2 words for the same thing. These are groups whose members share a common set of ethical or religious beliefs, and they have agreed to share healthcare expenses among the members. Next slide. So they agree to make contributions to help pay all or some portion of eligible healthcare expenses. However, they're not guaranteed that any part, you as a member are not guaranteed that any part of your healthcare expenses will be paid by your fellow members. And members are responsible for all expenses related to their healthcare potentially. Before joining one of these plans, read the description of the program carefully. So healthcare sharing ministries, that means read it carefully, understand the program that you're entering. Make sure you understand the guidelines, make sure you understand the limitations of the program, and make sure that you remember it's not a health insurance policy. All right, another thing that is not a health insurance policy. A discount medical plan is not a health insurance policy. A discount drug plan is not it's not a health insurance policy. It's a discount plan, not health insurance, and they do not pay your healthcare costs. They're going to offer you some savings on various healthcare goods and services. This can include prescription drug savings, doctor visits, eyeglasses, vision care, dental services, lab tests. There may be others, but discount, not a health insurance policy. The discounts are made available through arrangements with the healthcare providers. So they do have an arrangement and they're offering you a discount, but not the same as health insurance. You can find more information about these plans on our website as well. All right, so shopping for a plan during the Maryland Health Connection open enrollment. What do you need to think about? Well, you need to identify your personal needs. All right, and I recommend spending a little bit of time jotting down some of these thoughts before you make contact, with a representative from the Maryland Health Connection. What are my needs? Okay, you're going to compare the policies, and you need to compare and understand the costs. Next slide. So, who will the policy cover? All right, who am I purchasing the insurance for? What healthcare services or medications do you or members of your family currently need? If there's something important, jot that down. Make sure that that is covered under the policy that you're choosing. Do you have specific healthcare providers that you want to keep seeing? So healthcare providers, it's like the doctors that you see, a nurse practitioner that you might see. Do you have a relationship, an important relationship with a provider? And you don't want to sever that relationship by them not being in your network. Jot that down. Okay, this is a doctor that I need in the network. Next slide. Are providers that you want to see in the policies network? And what about hospitals? Some people might only want to visit certain hospitals. If you're one of those people, make sure that you will get coverage in a hospital that you would want to be in. Does the policy cover the prescription drugs you take? And is there coverage for your pre-existing conditions? Next slide. All right, let's do some terms. In-network providers. In-network providers are the providers that have a contract with your insurance company. If you receive covered services from an in-network provider, then generally you pay your deductible and any applicable co-insurance or copays. You may not be billed for the balance by the provider. So in-network providers, those are providers that have a contract with your insurance company. Next slide. Out-of-network providers. Those are all the providers that don't have a contract with your insurance company. Providers that don't have a contract. If you receive covered services from an out-of-network provider, the insurance company may not be required to pay any portion of the charges, or your copay or coinsurance might be larger than if the services had been provided by an in-network provider. It's important to know what you're going to pay before you see this in-network provider, because in some situations, again, the insurance company may not be required to pay any portion of the charges. However, in some circumstances, you may be able to see an out-of-network provider for the same costs as an in-network provider. And that's important in some circumstances. And then for more details, I do highly recommend the link that is at the bottom of this page. You can go to that link and it will tell you the process for requesting to see an out-of-network provider from your specific insurance company. And it also has lots more details. This is a whole presentation in and of itself, but it's important if you want to go and see an out-of-network provider, if you have really good reasons for doing so, use the company's process. You can generally call the number on the back of your card, or I do recommend you can visit our website and the process is listed on the page that is linked below. Next slide, please. All right, so compare and understand the costs, super important. In order to fully understand the cost of your health insurance, it's important that you know the cost that you're responsible for and those terms. What are those definitions? The image on the right here, it shows the policies under the Maryland Health Connection, goes from platinum to bronze. And with the platinum, you see higher monthly premiums in general, but lower out-of-pocket expenses. With the bronze, you're going to see the lower monthly premium in general, and then those higher out-of-pocket expenses. Next slide. And I'll touch on that in just a couple more minutes too, a little bit more. So what out-of-pocket costs will I have to pay when I need services? Those costs that you're paying yourself, they're coming out of your pocket. Depending on your insurance policy, your insurance company may pay most of the costs of your care. But you're responsible for premiums and out-of-pocket costs, such as copays, deductibles, and coinsurance. Next slide. So premiums. That's the amount that you're going to pay, often monthly, to have your coverage. You have to pay the premium each month or you'll lose your coverage. That's the premium. Next slide. And the deductible. The deductible is the amount that you pay before your insurance company starts paying its share of the costs. So in general, most plans start on January 1st. Not all, but most do. And that means if you have a $500 deductible, starting on January 1st, the first $500 of those costs you're going to be paying out of your pocket until you meet that deductible. Some plans don't have a deductible, many plans do. Most policies, most policies with lower premiums have higher deductibles. So the lower the premium, the higher the deductible. Not always, but most of the time. And again, you pay the full costs until you meet your deductible. Next slide. All right, what about copays? That's the set dollar amount. So for example, $20 copay for an office visit to an in-network provider, and maybe a $40 copay for an office visit with an out-of-network provider. And this fee might be in addition to any deductible, which you're still responsible for under the plan. So that's a copay. It's a flat dollar amount. Next slide. Coinsurance, a little bit more complicated. This is your share of the costs of a covered healthcare service. The coinsurance is applied after any deductible is satisfied, and it's written as a percentage. Some people are fine with that. Some people are comfortable with percentages. Some of us aren't. So if your coinsurance is 20%, let's look at this example here to see how that'll work. 20% of the allowable amount. So let's say you had an x-ray and the bill was $200. $200. But your insurance company has a contract with that provider. It's in network. They were in network, and the insurance company has already said the allowable amount for that x-ray is $150. And that provider has agreed to take $150. So $150 is going to be what your insurance company pays, and your coinsurance is going to be 20% of the allowable amount of $150. So assuming your deductible is already satisfied, it's 20% of $150, which is $30. Next slide. All right, most policies have an out-of-pocket maximum. This is the maximum amount that you pay before your insurance company will pay 100% of the allowable amount for covered healthcare services. So that means at that point, they're picking up all of it after you've met your out-of-pocket maximum. And this can change. Check with your insurance company to determine what is included in this amount under your policy or plan. Next slide. So additional things to consider. I touched on this for just a moment. The insurance companies use metal levels to describe the different types of plans. So when you're shopping for a plan from the Maryland Health Connection, you're going to see metal levels: bronze, silver, gold, platinum. So as you may have seen in that little chart, again, platinum, probably a higher premium, lower out-of-pocket expenses. So generally, the lower the monthly payment, the higher your out-of-pocket expenses when you need medical services. If you qualify for cost sharing reductions, those are reduced out-of-pocket costs like deductibles or copays. If this is something that you qualify for, talk to the Maryland Health Connection representative, and you can access these savings only by choosing a silver plan, and they should be able to step you through that process. Next slide. All of these plans offer essential health benefits. They're called essential health benefits. They offer doctor's visits, hospitalization, emergency care coverage, prescription drug coverage, mental and behavioral health care coverage, maternity and newborn care, pediatric care, and preventive care, such as wellness visits, shots, and screenings. So all of these health benefits are offered under all the plans from the Maryland Health Connection. Next slide. Another thing to consider, people under 30 may buy catastrophic coverage. So catastrophic health plans, they offer lower premiums, but high out-of-pocket costs, so higher than any other plans on the marketplace. They will offer you protection against very high bills if you're seriously hurt or injured. Next slide. These plans will cover 3 visits to a primary care doctor per year at no cost. So catastrophic coverage plans do give you 3 visits to your primary care doctor at no costs. They will also include free preventive benefits like vaccines or screenings, even if you haven't yet met your deductible. Unlike other plans, if you enroll in a catastrophic plan, you will not be eligible for tax credits that may lower your premium costs or other savings. So that is my part for today. Our contact information for the Maryland Insurance Administration is on this page. And with that, thank you. And I'm going to pass it back to Kiana.
Thank you, Patty. Again, if you have any questions, you can start putting your questions in the chat box, and we will address your questions towards the end. Our next presenter, Tamara Gunter with the Maryland Health Connection. Welcome.
Hello, everyone. So glad to be here. So my presentation today, what do you need to know before picking a plan with the Maryland Health Connection? Next slide. I want to thank you for having me. Here's my contact information. I'm very, very responsive. So feel free to reach out if you have any questions. Next slide. About the Maryland Health Connection. Next. The Maryland Health Connection is the state's official health insurance marketplace. It's your one-stop shop, compare plans, find savings, and get covered. Open enrollment to sign up for 2023 for health plans run November the 1st, 2020 through January the 15th, 2023. Go to the marylandhealthconnection.gov to enroll. You can start comparing plans now. Use the estimated tool to browse to see how much you can save. If you want to get covered for the new year, please enroll by December the 31st, 2022. That's very important. If you wait to enroll after this date, you will get a February the 1st, 2023 begin date. Next slide, please. Support. We have many people out there, boots on the ground, that's just ready and eager to help you get assistance. We have navigators throughout the state that are trained experts to assist you with enrollment. Education and enrollment assistance, information in person, over the phone, and online. Enrollment assistance, problems and issues, healthcare literacy, and related resources and access to care. We have 8 regions in Maryland. Our far west, our Midwestern, Capital North, Capital South, Central, Southern, Upper Eastern Shore, and Lower Eastern Shore. Now let's talk about the ways you can actually access the system. From your desktop, from your tablet. We even have a mobile app from your phone. All of these ways that you can enroll from the comfort of your own home yourself. But again, if you need some assistance, please don't hesitate to call our call center or our navigators. The only place to get financial help is through the Maryland Health Connection. In fact, 9 out of 10 who enroll get savings. And I know everybody's trying to save right now, right? The cost of groceries has gone up. So on the average, your savings is $289 a month on their monthly premium. Next. Am I eligible to apply? To be eligible for the health insurance, the Maryland Health Connection, you must live in Maryland, be a U.S. citizen or lawfully present. You cannot be incarcerated except for those pending dispositions. Additional notes, if additional family members are offered health insurance by your employer and it's deemed affordable, the state will apply the 9.12 rule. This means you will not be able to get health insurance if you're able to get health insurance through your employer and it's deemed affordable, okay? An additional, over the age of 19, must be lawfully present for 5 years before they are eligible for Medicaid. Next, please. So let's talk about Medicaid and private health insurance plans. So we put descriptions of the cards here just so you can know how the cards look, because sometimes, well, in a few cases, some of the MCOs and healthcare private plans also have MCOs, managed care organizations. So let's talk about eligibility, household size, household income, determinations, Medicaid M-CHIP, and private health plans. So here's the income guidelines for these programs. I won't go through all of them, but let's just discuss a couple. So a household size of 1 for adults is $1,564. A household, let's go to the household size of 5. Anything monthly income over $3,734. And you see when it goes up to the MCHIP program, it goes up a little higher. And the MCHIP premium, it goes up a little bit even higher. For those who don't know, MCHIP premium means that you're paying, it's not free, but you're paying a small monthly premium to get your child coverage. Next slide, please. Private health plans, licensed and approved, very important, approved by the state. The 3 carriers we have right now participating in the Maryland Health Exchange, Maryland Health Connection is CareFirst, United Healthcare, and Kaiser Permanente. Advanced tax premium credits, government assistance for the customer, reduced monthly premiums, cost sharing reduction, reduced plan deductibles. It decreases out-of-pocket costs for the consumer. Only eligible during open enrollment. Dental is a separate plan and is open during open enrollment. The young adult premium assistance. For 2023, young adults between the ages of 18 to 34 may be eligible to get help with their premiums due to a new state law, in addition to their tax credit. Let's give an example. For an adult of age 25, living in Allegheny County, the lowest cost Gold plan, roughly income of $25,000, their monthly payment is normally about $40 after their APTC tax credit. But of course, with the new Maryland law, they can get additional credit and only pay $1 for insurance. Next slide, please. Family status. There are many immigration statuses that allow someone to qualify for health coverage, such as lawfully present residents or temporary protected statuses. If you have someone in your household that are eligible, they should apply. We do not need status information from others in the household. So if you would like to apply, but someone in your household doesn't want to provide their status, you are able to apply, okay? Next slide, please. Let's talk about what's covered. This is very, very important. Preventive care, doctor's visits, hospitalizations, emergency care, maternity and newborn care, pediatric care, prescriptions, lab tests, mental health, substance abuse disorder treatment, and many more. When can Marylanders enroll? Again, open enrollment is November the 1st through January the 15th. If you come outside of this time frame, you must have a special enrollment period, which is a life event, which means losing a job, getting married or divorced, moving to Maryland, COBRA, before you can get enrolled after open enrollment. Of course, Medicaid is all year around. We also have a process called the easy enrollment process. If you check your tax forms and you say you need coverage, or if you file for unemployment and you check the box, you can get coverage. When you're ready to enroll, what will you need to have? Photo ID, very important. Social Security number, immigration, citizenship status for some residents, pay stubs or W-2 or tax statement if employed, employer income for the household, policy numbers of other insurances you may have, information about any job-related insurance for the family. It's very important. We all know from the videos that we showed earlier, life can be unexpected. So be prepared. Get a low-cost qualified health plan insurance that you can count on. All plans available through the Maryland Health Connection cover many services at no cost. For example, vaccines, screenings for diabetes, high blood pressure, and many cancers are included. You won't have to pay a copay or a portion of the bill. For mental health services, prescriptions, medicines, and visits to your doctor is also a very small. Where can I get help is the magic question of the day. You can go to the Maryland Health Connection webpage, but you're all covered website. You also can call the number 1-855-642-8572. We have a deaf and relay services. We have help for over 200 languages. We also have Broker Connect program. This is expert help. It connects you to a broker within 30 minutes. Consumer assistance. That's our navigators, our boots on the ground. They help people in person, virtual, and over the phone. Local in-person and virtual enrollment assistance. Our navigators and brokers have adopted safety protocol to support our mission. Over the phone, navigators and producers are standing by to provide one-on-one support to answer all of your questions. Virtually, navigators are able to walk you through the enrollment process on a computer. My favorite, in person. Navigators and brokers are available to meet with you in person and help you get assistance and enrolled. Meet the team of the Maryland Health Connection. That day, we actually had a picnic, maybe like a month and a half ago. It was a little chilly outside that day, but it was lovely.
Thank you, Tamara.
Thank you so much.
And again, if anyone has questions, this is the time to put them in the chat box. We have a few already there. So I believe the first question is going to be for Tamara. If you have a spouse, but are only insuring for yourself, do you have to include the spouse's income for enrollment?
Yes.
That was quick and simple.
Yes, you did.
Now, for the short-term coverage, 3 months, can people enroll over and over, or is it a one-time thing? And this is for short-term coverage.
Hi, Kiana. People can purchase the plans multiple times, but it's likely that they will be underwritten each time.
Okay, thank you. And what are the differences between the call center and the Broker Connect, Tamara?
So it's not a difference. It's just that the call center, we have to answer all your calls. Brokers are specialized in insurance and QHP, and they're able to find a plan designed to fit your need and your pockets. So they can give more advice regarding the insurance plans, but either one you can get enrolled. So the Broker Connect is just the system we have through our call center that quickly transfer the consumer over so they can get that specialized attention to make sure they get a plan that fit in their budget and, very important, fit their need.
Thank you. Again, if there's any questions. Okay, one just popped up. If you live with someone, but they do not file taxes with you as a dependent, do you include their income in qualifying for Medicaid?
The answer is no.
Thank you. As I'm looking and seeing any more questions, I guess y'all did a good job and a thorough job of explaining everything to everyone. But again, if you have any additional questions. Okay, so this will be, this recording will be on our website. If you missed anything, we'll put our website in the chat box so that you can reference it later. Someone does have a question. If my husband and I retire before the end of the year, oh, I lost it real quick, sorry. But okay, if my husband and I retire before the end of the year and will not have income in 2023, is there something different to consider in registering?
So I'm going to give this person my phone number because it seems like they need a little bit more. I have a little bit more questions for them. I don't want to air their business out on this call. So how about I leave my number. My cell phone number for that individual is, if you have something to write down with, is 443-970-1379. I need to ask you some questions offline to make sure I give you the correct answer.
You're muted.
They put the phone number in the chat box for you. Okay. And if there's no more questions, I want to thank everyone for attending today's webinar. I'm just seeing people write in the chat, so I'm going to pause for a second. So someone put brokers do help with applications.
Yes, brokers do help with applications. The brokers are really trained to give you that personal assistance to advise you on what plan. The navigators also, but the brokers can advise you on the plan, what the plan offers, and make sure it fits your needs. Just getting the insurance plan means nothing if it's not going to fit your needs in your wallet, right? It has to fit your needs and your wallet.
And someone said, what if I qualified for Medicaid in the middle of the year in February? So I guess if they have income that they didn't qualify and now February comes and they qualify for Medicaid, should I still need to enroll in the health plan and switch later?
So no, if you qualify for Medicaid, you're not eligible to get a tax credit. You can get the unassisted, but you can't get the tax credit. So you probably need to go with Medicaid if you're qualified for Medicaid. And again, if you need personal assistance, the numbers are available for you to call and get personal assistance from a navigator or the call center.
Yeah, and then that's probably a question you need to speak to somebody one-on-one in reference to that question as well. Okay, and what can FSA be used for? Copay, co-insurance, over the counter? So an FSA. Does anyone know?
Yeah, Tamara,
Yes,
did you want to take that one, or I
you can take it, it's fine.
Okay, so I don't, and what I'm just gonna say right now is that I don't have the details in front of me for that. You can shoot me an email at patricia.dorn@maryland.gov, and I'll put that in the chat right now.
Thank you, Patty.
You're welcome.
All right, and to help us evaluate the quality and the content of today's event, it would be helpful if you could please click on the link in the chat and fill out the brief survey. Again, this just helps us evaluate the quality of our webinars and also to learn what more you would like to hear from us about. So someone said, I believe that used for everything, the FSA may require receipts is a flexible spending account. So again, Patty, I guess you can just email them with more additional information.
Yeah, I'll follow up with more details.
Okay, thank you. All right, again, this presentation will also be repeated on Monday, November 14th at 12 p.m. in Spanish. Since there are no further questions, thanks again for attending today's event. The recording of today's event will be available on our website in the next couple of days. You can also find out all about our upcoming events on our website, www.insurance.maryland.gov, or you can subscribe to have our outreach calendar delivered right to your inbox. Also, please follow us on social media. We are on all social media, so there is no reason for you not to get information about the Maryland Insurance Administration. So thank you again for everyone attending today's events. And we look forward to seeing you next year. Thank you.
Thank you, everyone. Bye-bye.
Hi, everyone. Thanks, Kiana.
Thank you. Great job, everyone. Thank you.
Thanks.